Good morning, ma'am. I am Melanie Kagabgab. I'm here to demonstrate to you about the skin, assessing of the skin. The definition is assessing the skin that involves inspection and palpations. The entire surface of the skin may be assessed at one at a time, or as each aspect of the body is assessed. And then the purpose of the procedure is to identify problem areas promptly for prevention and treatment. The equipment to be used are the magnifying glass, the millimeter roller, and the examination gloves. The nursing consideration is a skin assessment should include the presenting concern or a compliant with the skin history of the presenting concern. Also the past medical history, the social history, and the family history, and also the medications for allergies and and impact on the quality of life. So before I assess, I will have to prepare my equipment to save time and effort. So good morning, ma'am. I am Melanie Katapab. I will be your nurse for today. So first, I have to check your skin if there is any discoloration or any bruises or lesions, so that you can know it. So now I have to wash my hands first, just to prevent transmission of infection, or use any gloves. Use gloves to prevent contamination. Now, first I have to check the skin and note that uh, any destructive odor, but we don't not there's any destructive odor, but we don't have to see it directly to the patients. Okay. Now I will have to inspect for any generalized color of your skin, or variations, just like a brownish or yellowish, or any redness or any color. Okay. And also to check the skin breakdown, inspect the primary and secondary and vascular lesions. Note that the size, shape, and other locations in the distributions and configuration. Then inspect, palpate the skin texture using the palmar surface of the three middle fingertips, like this, from the outside to the inner side, if it is rough or smooth. Okay, and palpate the palpate the temperature and moisture using the dorsal side of the hand, and moisture if it is a dry or sweaty or oily. So using a dorsal side of the skin. If it is oily or sweaty, and then palpate the thickness of the skin with fingertips if it is has edema. If the skin will not when you when you press the skin, if it's not go back directly to the position, to the yeah, to the position, it will mean, and it will remain, uh, when you press it, and it means that the skin the patient is have edema, or have a skin, dehydrated skin. Okay. Then palpate mobility are triggered by pinching the skin over the sternum. This one I have to pinch the sternum if the patient is back of if the patient is lack of oxygen or he is a dehydrated skin or she is a dehydration she had a dehydration. So this one I have to pinch this. And then the palpate for edema first, pressing the thumbs over feet and ankles to check if she have edema or biribiri. So if you press the skin and it will not get back immediately, the patient has an edema or a biribiri. And now that is the assessing of the skin. Thank you. So I have to document this one to document the assessing for the skin to to provide ongoing data or to provide collecting ongoing data.